Hi everyone. Today I am giving explanation on the topic Dacryocystitis. This is the Dacryocystitis part 3, in which I will cover the etiology of Dacryocystitis, which is a part of adult Dacryocystitis. So we should know about the adult Dacryocystitis in order to know about the chronic Dacryocystitis. So let us move to the definition of adult Dacryocystitis. Adult Dacryocystitis, as the name suggests, it is made for the adults, and the word Dacryocystitis means inflammation of the lacrimal sac. So in case of adult dacryocystitis, it is a kind of inflammation of the lacrimal sac which only occurs in adults. This condition is always seen in the adults. Next one is types of adult dacryocystitis. We have two types of adult dacryocystitis. First one is chronic dacryocystitis and the second one is acute dacryocystitis. Our target is chronic dacryocystitis. So chronic dacryocystitis is a condition in which a patient is suffering from that from a very long time. That is why it is known as chronic dacryocystitis. Etiology. Now the etiology depends upon 4 different factors. First one is predisposing factors. Second one is factors responsible for stasis of tears in the lacrimal sac. Third one is source of infection. Fourth one is causative organism. Predisposing factors always depends upon the 6 things. First one is age, second one is sex, third one is race, fourth one is heredity, fifth one is socio-economic status, and the sixth one is poor personal hygiene. Description. Age. The common age of a patient is between the 40 to 60 years. Sex. 80% of the women are included due to their narrow bony canal. Now 60% of the women 80% of the women are suffer from the chronic dacryocystitis just because of their narrow bony canal. Now this is the bone of the nose which becomes the narrow, due to which the patient have to suffer from chronic dacryocystitis. Next one is race. Rarer in Negroes. Negroes are the black people, as similar to the South Africans. So it is rarer in the blacks than in whites. Next one is heredity. Heredity is defined as the transmission of characters from the parents to their children. Affects the facial configuration and also the length and the width of the bony canal. Now the shape of the face as well as length and the width of the bony canal is matches with the parents of the children. So by this factor, heredity factor, it affects. Next one is socio-economic status. It is very common in the low socio-economic status people, common which are unhygienic people. So it is very common in the unhygienic people. Next one is poor personal hygiene. It is also common in those patients which have a lack of vitamins as well as minerals. Let's move to the next factor. Factors responsible for stasis of tears in lacrimal sac. Now these are the factors which are responsible for irregulation of the tears in the lacrimal sac. First one is anatomical factors, second one is foreign bodies, third one is excessive hyperlacrimation, fourth one is mild grade inflammation of lacrimal sac, and the fifth one is obstruction of lower end of NLD. Let's discuss about them. First one is anatomical factors. Now anatomical factors are again divided. Those factors are given which helps or which are responsible for retardation of the drainage of tears, which means those factors are given here which are responsible for the slow down the drainage of tears rate. First one is narrow bony canal. Next one is excessive membranous folds in NLD. A lot of the membranous folds are present in the nasolacrimal duct, which slows down the drainage of tears. Next one is foreign bodies. If present in the sac, if the foreign body is present in the sac, it may block the opening of nasolacrimal duct because there is an obstruction. Next one, excessive hyperlacrimation, a lot of the watering. Now over-secretion of the tears may be primary or reflux with the cause of stagnation of tears in the sac. Watering of the tears may be due to both of the reasons. It may be due to primary reason and it may be due to reflux reason, and with the cause of stagnation of tears in the sac, and it becomes the cause of stoppage of tears in the sac. The tears get stopped in the sac and it will not allow the tears to drain off through the nasolacrimal duct, or the way is closed from which the tears have to go from the lacrimal sac to the nasolacrimal duct. So the tears get permanently stopped in the sac. Next one, mild grade inflammation of lacrimal sac. Sometime when the again and again conjunctivitis occurs, it may block the nasolacrimal duct because epithelial debris are the deposits, epithelial deposits and the mucus plate present there. So the way gets blocked. Next one, obstruction of the lower end of the NLD. Now there is a obstruction which is present at the lower end of the nasolacrimal duct. It takes place due to nasal diseases. Sometimes the nasal disease occurs such as polyps. Polyps is the abnormal cell growth or a tissue growth which is present on the mucous membrane, and in case of tumors a mass of tissue grows there. Okay, so these diseases becomes the reason of the obstruction of lower end of NLD. Let's move to the next factor, which is a source of infection. Now the lacrimal sac sometimes get also affected from the conjunctiva. Okay, infection takes place in the conjunctiva part, but lacrimal sac get also infected from that. So in this way it becomes a source of infection. Next one is causative organism. We have three types of organisms. First one is Staphylococci, second one is Pneumococci, and the third one is Streptococci. So in this video I have already covered the etiology part of the chronic Dacryocystitis. Thanks for your patience listening.